Hey guys, today we're talking about why females need velocity-based training. There's a lot of reasons that you're about to find out. Well, one, they're twice as susceptible for severe stress and anxiety, and I can attest to that in my own studies and my own data. So it's just quite clear. But there's a whole lot more than just the fact that they're high in that category. They have an individual impact of the menstrual cycle, something obviously guys don't have to deal with. Hormones in guys fluctuate as well, but just not to the degree. Later, you're going to find out the degree of like individuality when it comes to that. It's just not a one size fits all, because some people don't fluctuate at all during their cycles, their 28-day cycles, and some fluctuate a lot. But probably not telling you guys something you don't already know. And then there's the negative impact of social media. And you're going to find out too that women suffer from negative impacts more so than men, and to a much greater degree. When you talk about social media bullying and stalking, it's as you see that right there, the 0.33 was a 20% plus fluctuation from her normal velocity, 85%. That doesn't happen in men. So. Like I said, women are more negatively impacted by social media, and I feel like, in my experience, their ability to auto-regulate, I don't know if it's just the pressures of society, but they're harder on themselves. That is totally just anecdotal in my experience. I have no proof to back that up, but velocity is really good to help women learn to auto-regulate, and young boys. So now, possible impact of the menstrual cycle. We'll go over it phase from phase. The follicular phase is the first day of one's period through ovulation. It's about 14 days. During that period, testosterone or high is at its highest, and estrogen is at its lowest. There's some good and bad for both of those, and I'll explain a little bit later. So during the menstrual cycle, the body's temperature, insulin, and the metabolic rate are at baseline. So velocity and readiness are all over the place. After the period, it's the best time to go heavy and high volume, but you want to monitor that. Like I said, everyone fluctuates, and the closer they get to ovulation, they're at risk of injury too. So there's the plus and the minuses. So during ovulation, estrogen and luteinizing hormone are at the highest. Progesterone and body temp rises, and so that means it's a really good time to go super heavy. However, you're at the highest risk of injury because high estrogen inhibits the fibroblasts, which is responsible for the creation of tendons and ligaments. Let's talk about the luteal phase. Progesterone, estrogen, and body temperature elevates and decreases if there's no pregnancy, which, if you're an athlete, is probably a big plus. Then it's not great for high intensity, but it's great time for losing body fat with a high metabolic rate. But like I said, you got to monitor it to make sure that that's true for you. It's definitely a good time to monitor it with velocity, which almost all the time is. So now we're going to test for daily readiness with either GymAware or the Flex. My recommendation is you can either use the jump squat, which is with about 25% of your back squat PR, because you can do that on an everyday basis without creating a lot of damage. But you could also do it with the front squat, with the hang clean pull, but between 80 to 85% of your 1 rep max should tell you what you want to know. My recommendations: if you're below, somewhere between 1 to 4% lower than normal, just be aware and look at the subjective questionnaire. If you're 5 to 9% below, I would cut volume and or intensity by 10 to 20%. If you're more than 10%, cut the session. Do a little bodybuilding, maybe some blood flow restrictions, but take it to the house and recover. Now, with using a subjective questionnaire, it's going to give you the why. If something is going poorly, you need to know the reason. And a lot of times, the athletes aren't going to tell you, but the subjective questionnaire, you can look and you can really infer a lot of things. If their body weight is fluctuating majorly, if their sleep, and especially if you're seeing that their stress outside the gym is higher than normal, it opens the door for you to ask them why. So, communication with your athletes is always going to be the way that we're going to get to the bottom of what's going wrong. So here are some recommendations. If you're seeing a lot of stress with your athletes, breathing and meditation skills, arousal regulation techniques, stress coping skills, these are all good things to teach our athletes to help them better deal with, the stress that, like I said earlier, with social media stalking and, the bullying that they're dealing with, stress is at an all-time high, especially for females, based on the research. Peer intervention is a great way to help with some of the problems they're dealing with. If you find an older athlete who's been through some of the similar things that they're going through, teaching them positive self-talk, and then for you, helping them set realistic expectations. That's all good ways to deal with stress. Process goals versus outcome, meaning you're focusing on the day-to-day process of what they're going through versus lifting a certain weight or beating a certain person. Then there's promoting an environment of positive, open communication. That's very important. You don't want to shame athletes for just talking about the things that they're dealing with. And lastly, optimize attentional focus based on the task, because athletes are going to have to learn to overcome, being stressed out. And so they need to learn to focus on whatever task that they're doing at the time. If you want your athlete to one day go to the Olympics and compete in the Olympics, then they have to be able to shut out a lot of stress and focus on the task at hand. So anyway, I hope some of these things will help your athletes deal better with stress. Obviously, using velocity to monitor the things that they're going through and to monitor the fluctuations of stress by looking at fatigue. So anyway, thanks again, and till next time.